So this is the last section of our lecture. Now we're going to talk about the treatment of GB syndrome. We will see what are the different methods by which we can treat this disease. We have high dose intravenous immune globulin, we have plasmapheresis, and there is glucocorticoids. How these can be used for the treatment of different patients, and what is the prognosis and recovery of GB syndrome. The treatment should be initiated as soon as possible because each day counts 2 weeks after the first motor symptoms. It is not known whether immunotherapy will be still effective after the 2 weeks. If the patient has reached the plateau stage, which I have already told you that in this stage there will be no change in symptoms and the patient will start recovering. The treatment is not indicated in case of a plateau stage. So we have to start the treatment before this stage is reached, unless the patient has severe motor weakness. So treatment is not indicated, but unless the patient has severe motor weakness, we can initiate the treatment. And if we cannot exclude that immunologic attack is still going on. So high dose IVIG, immune globulin, or plasmapheresis can be initiated as they are equally effective for the typical GBS, but the combination of these two therapies is not better than either alone. So IVIG is often the initial therapy chosen because of certain reasons, which are ease of administration and good safety record. It is usually preferable for the acute motor axonal neuropathy and the Miller-Fisher syndrome variants of GBS. How we start IVIG immune globulins, 5 daily infusions for a total dose of 2 grams per kg body weight is started. And how we can neutralize the autoantibodies, but they are neutralized by the anti-idiotypic antibodies which are present in the IVIG preparations. Plasmapheresis is 40 to 50 ml per kg of plasma exchange can be done 4 to 5 times over a week. And meta-analysis of randomized controlled trial, it indicates that reduces the need that plasmapheresis reduces the need for mechanical ventilation by nearly half. Like after plasma exchange, 27%, it reduces from 27% to 14%. And plasma exchange or plasmapheresis increases the full recovery period at 1 year from 55% to 68%. After plasma exchange, there is improvement towards the end of first week, but it might be delayed for several weeks. If there is lack of improvement after the IVIG, immune globulin, or plasma exchange, it is not an indication to initiate an alternative treatment. Some patients are treated early in the course of GBS and improve, but they relapse within a month. So brief retreatment with original therapy is effective in such cases, but not an indication to change the treatment or start an alternative treatment. What about glucocorticoids? Glucocorticoids are not effective in case of GB syndrome, but they can be used in mild forms of GBS or in patients who have reached a plateau when initially seen, or they have come at the plateau stage with their first visit. They may be treated conservatively. Now there is a worsening phase of GBS. What happens? In case of worsening phase, monitoring in a critical care setting is essential. Frequent turning and assiduous skin care is very important, so to prevent bed sores. Their daily range of motion exercises should be performed to avoid joint contractures. and 30% of the patients in worsening phase require ventilatory assistance. In this phase of GBS, particular attention should be paid to the vital capacity, heart rhythm, blood pressure, nutrition, DVT prophylaxis, cardiovascular status, and early consideration of tracheostomy. Because in worsening phase, there is autonomic involvement which can cause derangements in heart rhythm and blood pressure. It can alter the cardiovascular status. There will be electrolyte imbalances leading to inappropriate nutrition. The patient will not be able to move, so there is a risk of DVT. And if there is respiratory involvement, the patient might not be able to breathe on his own. So either ventilatory assistance is required, or there should be early consideration of tracheostomy. And chest physiotherapy is essential as well. So if we talk about the prognosis and recovery, 85% achieve a full functional recovery within several months to a year. Minor findings on examination may persist even after recovery, such as areflexia. Patients often complain of continued symptoms like fatigue, anorexia, malaise, and tiredness. Mortality rate is less than 5%, but if death occurs, it usually results from secondary pulmonary complications, not directly from the GB syndrome. Outlook is worse in patients with severe proximal, motor, and sensory axonal damage. It may either be primary or secondary in nature, and in either case, successful regeneration cannot occur. Now there are certain factors that worsen the outlook for recovery. What are these factors? These are advanced age, fulminant or severe attack, delay in the onset of treatment. So these 5 and 10% of the patients have late relapses, which are classified as chronic immune demyelinating polyneuropathy. So these factors are very important for recovery. If the patient is old, or if the attack is severe or fulminant, or if the treatment is delayed because of any reason, these things are going to cause the prognosis and recovery for the patient. So this was all about the GB syndrome. We have studied the different types, which are the acute inflammatory demyelinating polyneuropathy, the axonal variants, and the Miller-Fisher syndrome, which is a rare type of GB syndrome. We studied the heterogeneity, the clinical features, which are basically it is the rapid onset muscle weakness, which it starts from the lower extremities and ascends bilaterally in a symmetrical pattern. And then we studied about the immunopathogenesis, that cellular and humoral immunity both are responsible for causing the damage. Then we studied the diagnosis, how we can diagnose by the examination of the cerebrospinal fluid and different electrodiagnostic features. We saw the differential diagnosis and how we can differentiate these. And finally, we saw that for treatment, we can give IVIG immune globulins and plasmapheresis, and if they are initiated on the proper time and early in the course of the disease, the recovery and prognosis can be remarkable. So this was all about GB syndrome. Thank you for watching sqadia.com.